there seems to be a war, well, maybe not a war, maybe a battle among healthcare providers, specifically any providers that are that the AMA views as uh, involved in scope creep. Yeah. Hello, hello, and welcome. As you come in, don't forget to hit the thumbs up or like button. I'm Clarice Warner. I'm the girl with the pearls, the founder and senior education director of the Professional Reimbursement Network LLC, where coding education is key. And PRN is a healthcare compliance consultancy located in Cincinnati, Ohio, that specializes in revenue cycle and regulatory compliance and education. Now, today we are in for a treat. We are hearing from the advanced nurse practitioners. Yes. We want to talk about what's going on out here in these nurse practitioner streets and how are they feeling. So our focus of our discussion today is really nurse practitioner advocacy. We want to talk a little bit about, as we've discussed several times, the AMA's scope creep initiative and some of the foolishness that's happening over there, as well as nurse practitioner training and thoughts on full practice authority. So today I have with me Ms. Sonya Wells, who is the co-founder and president of the African American Ambassadors of Excellence in Advanced Practice Nursing. Welcome. Ms. Sonya Wells is a remarkable individual with a diverse range of skills and experiences. As a board-certified family nurse practitioner, her expertise spans urgent care, adult medicine, family medicine, GYN, women's health, addiction medicine, and occupational health. Sonya is also the CEO and principal consultant at Sonya Wells Public Health and Wellness Consulting. She is the co-founder and president of the African American Ambassadors of Excellence in Advanced Practice Nursing, or AAEAPN. Is there a word to say it, or do you say it, just say the...
Just like that.
Just like that. See, some people have a little saying that goes along with the acronym. It's a 501c3 nonprofit organization focused on empowering African American nurse practitioners through leadership, mentorship, and education to deliver the most innovative and quality care to the patients they serve. Sonya's active engagement in panel discussions, community outreach initiatives, health walks and runs, speaking engagements, and serving on the board of various professional organizations showcases her dedication to making a positive impact in the healthcare community. Sonya is deeply committed to aiding and empowering African American nurse practitioners while also guiding individuals overall towards achieving heightened levels of mental and physical resilience and enhancing their overall quality of life in alignment with her divine calling. So, y'all, let's welcome Miss Sonya Wells. Yes.
Thank you for having me.
You are welcome. I'm so excited that we're finally getting this done. It's been a minute in the making. We've been talking about this for a while, and I'm just excited. I'm excited because I know we about to spill all kinds of tea, and I do have my tea here. So, so let the tea spilling begin. We are speaking with Amanda Rumpke, DMP, APRN, CMP. Yeah, that's a lot of alphabet soup there. I'll let her talk more about that. She is the president of the Ohio Association of Advanced Practice Nurses. So, before I begin, let me give you her formal bio. So let me be real formal for a moment. So Amanda is a certified acute care nurse practitioner specializing in pulmonary and critical care. She received her nursing degree from Miami University of Ohio in 2003 and attended the University of Cincinnati, where, hey, we share alumni, where she obtained her MSN in 2009. In 2019, she successfully completed the Duke Johnson & Johnson Nursing Leadership Fellowship and earned her DMP from the University of Cincinnati in the spring of 2023. Congratulations. Amanda has witnessed healthcare delivery through a variety of nursing and leadership roles over her more than 20-year healthcare career. Whether it be as a nurse in a medical ICU, a unit-based educator, a unit secretary, an APRN, or director of advanced practice. Currently, Amanda supports nearly 1,300 advanced practice clinicians across 4 states. Additionally, she appreciates opportunities to speak to local and national audiences regarding various topics, including virtual health, CMS's split and share rule. That is where we first got together. Effective clinical workforce utilization and the importance of top of licensure hospital privileging for advanced practice providers. The opportunity to further engaging and empowering caregivers through the OAAPN has been especially rewarding. In her prior roles as in the OAAPN is the Ohio Association of Advanced Practice Nurses. As the co-director of Southwest Ohio and president-elect, Amanda has expanded access to leadership training for all Ohio APRNs. She looks forward to furthering the partnership with the Ohio APRNs and OAAPN to support healthcare for all Ohioans. In her free time, if she has such a thing, she likes to run and practice yoga, which we share a kinship for that as well, while spending time with her husband and 3 daughters on their farm in Liberty Township. So let's welcome Amanda to the stage. Yay! The AMA published several articles in the last several months around scope creep, initially directed towards nurse practitioners and advanced practice nurses, even those with terminal degrees. The shots just were fired. And not only have we taken notice, but others had taken notice as well. And I personally wanted to provide a platform or provide an opportunity for some advanced practice nurses to speak in defense, if you will, on what you all do, but also be on the offense to align the public, to educate the public, and provide them an opportunity to understand where you come from as an advanced practice nurse, your training, and your role in helping patients in all of our facilities. So, got a couple questions for you. So the AMA article emphasizes the difference in training between physicians and nurse practitioners. And so can you elaborate on the strengths you see in nurse practitioner training and how it prepares you to deliver quality care?
For sure. So, nurses are trained as nurses. I think that's a fundamental point. The AMA calls out training differences between physicians and nurses, and that's 100% true. And quite honestly, I think it's a good thing. I feel like nurses are trained in a nursing model that is focused on the whole patient. They are truly, really geared towards everything that patient needs, even beyond the physical or the things that can be diagnosed. And so when we think about the role of the physician versus the role of the nurse, they often do similar things, but they contribute to different parts of needed patient care. So in my estimation, how I was trained helps me get at a different aspect of patient care that is complementary to that of my physician colleagues.
Sure, it's definitely, there's no secret that there is a difference in the training. Doctors have extensive, long years of training, and we have to look at, it's like two different tracks. It's just two totally different things, honestly, all trying to get to the same objective and goal. And so with our training, we use our clinical skills and the critical thinking that we have gained from our nursing background. And we pull this all into this provider realm where we work side by side with either a doctor or a fellow nurse practitioner. And we do this learning how to assess, how to diagnose, how to treat. And it works, it blends perfectly. And so that is the strengths that I see in our training. We're using all of for example, myself, I was in nursing for years and in the surgical trauma ICU, you know what I mean? So I was able to take all of that knowledge and education and experience and bring it into this provider role.
But I know some physicians too. I know some physicians um, who also do a great job in what they're doing and who have raised some eyebrows like, well, I don't what are they doing? What are they trying to do with all of this um attack, if you will, on some of these professions when, it's really about the team. It should always be about the team. And at the end of the day, it should always be about the patient, but
Yes, about the patient. That's what it's about.
always.
And like you said, it's some amazing physicians. Like I've worked with some amazing physicians. I have some awesome mentors, and it's about collaboration
Mhm.
for the betterment of the patient.
Yes. The article raises concerns about patient safety with increased scope of practice for nurse practitioners. How can we ensure that patient safety remains a top priority as healthcare delivery models evolve?
Yeah, I mean, first and foremost, we use evidence-based practice, and so that kind of leads what we do. We participate in interdisciplinary collaboration always. Um, we do holistic patient care, communication is huge, ongoing professional development and continuing education, ethical practice. It's just things that we do that we have been taught, and that I feel ensures quality patient care. If we stick to those things, we have no choice but to provide quality, high quality care.
Absolutely. I'm passionate about patient safety too as a nurse. And as you know, nurses across the history of time have been deeply involved in care quality and patient safety. Many nurses having invented some of the best practices we have in the patient safety space. So honestly, I think the foundation of safe patient care comes from a collaborative approach to really understanding what goes wrong when we deliver care and how we get out in front of those issues. Continual education and an environment where it's safe to raise concerns and also safe to really embrace the humanness of care delivery and grow as providers. Nurses have opportunity to improve in their safety practices just as every other clinical discipline does. So all of us coming together in a multidisciplinary way to learn from one another, in my mind, keeps patients safe.
I totally agree. Totally. The AMA portrays itself as the advocate for physician-led care. Do you see nurse practitioners as complementary members of the healthcare team or as a potential replacement for physicians?
So that's an interesting question. And as I mentioned before, I absolutely view advanced practice registered nurses as complementary to physician care. The fact of the matter is, we're a multidisciplinary care team. all bringing unique skills to patient care. And truly, the patient is better off having all of these clinical disciplines at the table, focusing on different aspects of their health. So I don't see advanced practice nurses, whether they be nurse practitioners or nurse midwives or uh, certified registered nurse anesthetists, they don't replace physicians. We work side by side to take care of patients in a holistic way.
Right, I agree. And at the end of the day, it's all about the patient, right?
Absolutely, yes.
Absolutely complementary. Like, we never came into this like, we're going to replace the doctors. That was never our intention, you know? We're just here trying to fill in the gap. There's a clear gap. Doctors don't stay in primary care like they used to, you know. Often I get patients and they're like, oh, you know, unfortunately, my primary care passed away. They had been going to them for years. That was a different generation. And so they're not staying in primary care. They're moving on to specialties and different areas of medicine. And so it's leaving our patients without care, ultimately, is what it is doing. And so we are filling in the gap. We want to work as a team. We never were here to replace.
Right. Be like, so call off the guard, call them back, call them back.
Call the dogs off.
Right. God. So some states grant full practice authority to nurse practitioners, allowing them to practice independently. What are the benefits and drawbacks of this approach from your perspective?
Well, I think there are lots of benefits. Truly, in many circumstances, collaborative practice is simply a contract. It doesn't actually ensure safe patient care. It doesn't really ensure that there's good collaboration or communication between a physician and an APRN. So, from my perspective, I think we should focus on truly collaborating, getting patients to the right level of care at the right time, to the right clinician at the right time, and focusing our efforts not on contractual agreements, but on which clinical discipline the patient would benefit most.
How can collaboration between physicians and nurse practitioners be optimized to deliver the best possible care for patients, regardless of the practice authority model?
I think if we can take the competition out of it, we're all better off. You know, sometimes professional organizations take this approach where they're pitting one clinical discipline versus the other. And honestly, we're all better if we work together. Um, Recently, in my role as president of OAAPN, I was honored to partner my organization with the Ohio State Medical Association to work towards comprehensive legislation to make care more efficient for APRNs. And this doesn't have to be contentious. It truly can be meaningful collaborative work with one another. I think this is demonstrative of the work that all organizations could do to come together and keeping patients first.
So is this involve the work for the win that you received at the State House?
Yeah, so we recently had proponent testimony for Senate Bill 196. We have a coalition of like-minded organizations that are focused on enhancing access for patients that are supportive of this common sense legislation and a real bipartisan effort to make care more efficient across the state.
So is there any more that you want to elaborate on that particular House bill for the layperson?
To the layperson, this is an efficiency for you. If you come for a pre-employment physical, you could currently experience a scenario where you are being evaluated by an APRN but that form may need to be signed by a physician, which means that you may come in for your visit, but then have to come back to get a signed form by a clinician that didn't actually perform your exam. So thinking about it that way, from a patient lens, this legislation just makes sense.
It does, because I would feel some kind of way that I have to make these additional trips. It does. It does. Well, congratulations on that. Congratulations. And even the collaboration between all parties who understand, who identify, understand, and recognize that how beneficial is this for our patients at all, and affecting a policy change to strengthen access for our patients. So I applaud you guys, and congratulations on that win. So I know here in Ohio we don't have full practice authority, but if we were granted full practice authority, how would your practice approach change, if at all?
I don't think that it would, because
Okay.
the way that I practice now is I always collaborate. I'm always communicating. I refer patients. I work with the interdisciplinary team. You know what I mean? And so I personally don't take jobs where I'm, working where I'm being overseen or I'm working as a backup. And I teach my mentees not to take positions like that either, because we have been trained and we have the schooling and the education to practice in our full scope. And
That's right.
so,
Walk in it. Walk in it.
and so with that,
Head held high.
right. So with that, you know what I mean? We always have a collaborating physician, which we do when you don't have full practice authority. And so you can reach out to them. They review some of your charts. They're your like go-to if you have questions and so forth. But I don't think that my practice would change much.
Quite honestly, my practice would be exactly the same.
Everybody says the same thing.
I would continue to take good care of patients, and when appropriate, when they need something that I can't provide, that is truly outside the scope of my practice, they need a procedure that I'm not trained in, they need advanced evaluation by a trained specialist, then truly it is my obligation as a clinician to get them to the right provider.
How do you think we can improve public understanding of the different roles of physicians and nurse practitioners in the healthcare system?
Well, I know, and I'm sure you know as well, um, patients are confused about who's providing their care, and they should have some more information about that. And I think that, again, this is an area where organizations could come together and provide some patient-centric education, in an unbiased, open way, um, because there should be a choice.
Yes,
The patient should have a good understanding of who they're seeing and should be able to select the provider that most aligns with their needs.
I agree. I agree. Um, I know oftentimes you go to facilities, particularly I see it mostly or primarily in hospitals, where everybody's badged, but then they also have kind of an additional placard on their badge that identifies their role. So you'll see physician, you'll see nurse practitioner, you'll see nurse, you'll see whatever role that folks are playing. And oftentimes it's clear, but to your point, it can be confusing to a patient if they're not 100% sure. Okay, well, I see nurse practitioner, but what actually does the nurse practitioner do, or what can a nurse practitioner do? And so I agree. I think there should still be some education around the choice that patients particularly can have.
Yeah, it's a struggle.
You're like, and the struggle is real.
It is, but I think, just continuing to have that clear communication with patients right from the get-go, what's my qualifications, what's my expertise, what's my role in your care. I think through public health initiatives, I think, media representation, I think that they are doing an amazing job with having nurse practitioners and other people that's in the healthcare system on segments and, putting their correct title and information and how they can be contacted. I think that's a great way to get it out to the public. And then, it's just going to be communication. It's going to be every time you see Mr. Brown. Good morning, Mr. Brown. I'm your nurse practitioner. I am your primary care provider. This is what I can offer you every single time if that's what it takes.
Yeah.
The AMA article didn't mention much about patient preference, but in your experience, do patients ever express a desire for a nurse practitioner or a physician? And if so, how can we ensure patients understand their options for the care providers? I know we kind of just talked about that.
Yeah. I think patients do deserve a choice. And really, the foundation of that choice is knowing the difference between the clinical disciplines. So, educating patients on the front end and providing them with care options to match their desires, their needs, their perceived needs, I think that's really, really important. Certainly, I have taken care of patients in my longer than maybe I realize at this point or want to admit healthcare career.
Doesn't it fly by? It just flies by. I look up like, oh my God, I've been doing this for so long.
that prefer a nurse. And I have met patients that prefer a physician. And I have met patients that need one or the other. And so I think in a perfect world, the needs and wants of patients are matched, and that our healthcare organizations are really working towards a solution that helps direct patients appropriately.
Yeah, sometimes I think often it's generational, so our older generation, they just don't know enough about us. All they know is that the doctor is who you go to when you sick. You don't ask no questions. And that's just the way that it is. Our younger generation, they are much more open to options. They are looking for that entire total experience. So that bedside manner, that communication, that expertise, you know what I mean? And so I think that they are more open. And so they are willing to see other providers of the healthcare team, nurse practitioners, PAs, different people like that. And I think, again, authentic communication, who I am, what my role is, what are my qualifications, how am I going to be moving in your care plan, and then reiterating, my skill sets. I'm qualified to handle all of your healthcare needs. If we need to pull someone else in, I will most definitely do so.
Yeah. I think you're right. It is a generational thing because, folks of previous generations, baby boomers and such, they were taught, you don't question authority, and they are the authority as it relates to this. And so you take what they say, you do what they say, you take this pill, all of the things. They don't even consider or think about, well, can I ask you a question? Can I, it was just the strangest of dances that used to happen. I think the younger generation is more inquisitive. They want to know, like, explain to me,
Yes.
You said so and so and so. So explain to me, how does this work with this activity I may be doing? Or how does this work with this medication I may be taking? And so they really want to know. Also, folks are busy. And things could be going on. It's like, well, I need to see somebody today, or I need to see somebody soon. And so availability also matters, because oftentimes, yeah, word on the street is this particular physician may be great at what they're doing. However, you can't see that physician for another 6 months. Well, is that going to help me today with whatever issue that I'm having? However, providing the options of someone who's just as great, who can provide just the same or better type of care, also should be an option. And so I think seeing that options are available, providing the availability to patients is another thing that even the younger folks, I think they love.
Mhm.
And I know I see a lot of people who actually have nurse practitioners as their primary care physician. They don't want to see it. I mean, just because of the relationship, and to your point, the holistic care that you all provide based on the training that you have, they would never go back. They're like, absolutely not. I'm cool with this. I'm a caregiver for my mom, and so I've been in a couple of tug of wars where one specialist she would have is the nurse practitioner, another specialist is a physician, and and so on and so forth. And I'd be like, well, what we're not gonna do is play that game. So you give me your perspective, and then I always tell them, like, I play in the healthcare sphere. I'm compliance, so and a health information practitioner. I can read your charts. I know what you're talking about. I have some clinical knowledge. I was a biology major. I got a little things. So I'm following everything you're saying. But what we're not gonna do is try to downplay somebody else. Now, if you got some evidence or something that you want to share with me that may allow me to research to see which way I want to move with my mom, then by all means share that. But you're not going to just be like, well, because I'm the doctor, we're not doing that. No,
Yeah, and
no.
the other
Like, you
thing
don't
is
know
that
me.
people treat things differently. I have that conversation with patients often. What's the saying? There are more than one ways to skin a cat.
Exactly.
So, it's different ways. And then, like we talked about before, we're bringing that entire bedside experience. We were the ones that were at the bedside when you were at the lowest and sick. We were the ones at the
Ma'am.
bedside when your mother was in her dying stages. You know what I mean? So we have that conversational piece where some people,
Like, you're talking with them and not talking at them.
exactly.
And yeah. That is so true. And I think that shines through with the bedside manner. Now, don't get me wrong, there are some physicians that are on it and they know,
Absolutely.
but you have others that they're like, do you even really want to be here? And it's okay if you don't, because you can send somebody in who
Mhm.
does. Like, you don't want to, like, my mom's endocrinologist, he is something else, and he like scoots his chair, he's all in her face. Now she's like, and she's like, sir, talk to her. Don't talk to me, because she ain't really even paying attention to him, like, whatever. And I was like, yeah. And so, but I
Yeah.
appreciate that he includes her, even though she don't want to be bothered. She don't really want to hear what you got to say. She ain't paying attention. You are my patient, ma'am. I appreciate that
Mhm.
your daughter is here. Ultimately, I'm hearing she and I are having a conversation through you, but I appreciate that he brings her in. He's looking at her. He's engaging her in the conversation. So yeah, and so folks understanding their patient, understanding how to communicate with their patient, and just understanding that sometimes it's just the small things that mean so much.
Mhm.
And believe it or not, whether the healthcare professionals want to believe it, it's still a customer service type of industry. And
Yes.
folks do know, and they're learning, especially our younger folks, you could be fired too. I don't have to go to you. If I don't like it here, I don't have to come here. I can go find somebody else. And older generations, they stick and stay. They didn't care. He was mean. I didn't like him. Well, why are you still going there? They didn't understand that you have choices. These younger folks, they know.
Oh, they know, and they will fire you, and they will fire the next one, and the next one too. And I
Until they find what they looking for.
you know,
Exactly.
you have to be an advocate for yourself. You have to be,
Yes.
especially in these days.
Yes.
And we could get into all of that another day, but
Yes, yes, yes.
So, what are your thoughts on the future of healthcare delivery? And how do you see nurse practitioners playing a role in that future?
Well, I think it's very clear that nurse practitioners are here to stay. I think that the future of healthcare delivery is multidisciplinary. And as I mentioned before, this is a good thing for patients, in my view. I think if organizations can come together and be sure, again, that we're getting patients to the right provider at the right time, that we're optimally using our clinical resources to the top of their training and getting patients where they need to go, that we will continue to see improvement in outcomes.
Yes, I totally agree. Totally agree.
The article talked about the Ochoa-Dinkins case. And they used this tragic case as an example. Again, shadily against nurse practitioners. But can you share some instances where nurse practitioners have provided exceptional care, perhaps even identify issues that were missed by other providers?
Unfortunately, doctors and nurse practitioners make mistakes.
We all do. We're human.
Yeah, it's not intentional, but we're human. And so it's never malicious or intentional, but it's all the time that, nurse practitioners find something that another provider missed. It's medicine. It's not
Mhm.
foolproof, and so we as providers, we must just do our due diligence and collaborate, as I always say, double, triple check, use our evidence based resources and tools and handy dandy things that we got in our back pocket, our skills, and ask for help and, put the ego away when we get to a point where we like, this is a bit outside of my scope. You know what I mean? And so I think that along with our continuing education,
Mhm.
is going to drive down the mistakes. But mistakes are going to happen.
They're going to happen. They happen every day, unfortunately. And to your point, they're not malicious. They are just that, mistakes. Um, and to highlight a mistake as the way they did, I just, I'm like, oh boy, y'all coming for the jugular. I don't understand why.
It's so many mistakes that's made, and I'm not saying that makes it okay, but to highlight that particularly when, all you got to do is talk to a liability insurance company and they'll run it down for you, the type of mistakes that's
all
going
day
on in the healthcare field, and it ain't by us. No.
Ma'am. all you got to do is sit on some of these ethics committees and listen to some of the things that happen behind closed doors on, well, what do we need to do going forward? Risk all of the people like, no. Everybody can get it. And so don't do that.
Absolutely. That kind of care happens every single day. And unfortunately, sometimes we have a tendency to point out just the negative. And the fact of the matter is that there are opportunities to improve in healthcare delivery across the board. Are there opportunities for nurse practitioners to improve clinically? There absolutely are. But just as many opportunities as there are probably 1,000 more examples of excellent patient care. I have seen this play out day in and day out for the last 20 plus years. And again, focusing on what we can do better as a whole, how we can evaluate our clinical practice, how we can come together in that evaluation makes us better.
Some areas have physician shortages. We all know that. And how do you think nurse practitioners can help address these disparities in access to care? And how can we ensure quality care is delivered in these particular areas, specifically rural and urban areas?
Absolutely. So access to care is an issue. And I think one step in the right direction is breaking down barriers to access. So if, for example, a contract is required between a nurse practitioner and a physician, and that contract requires a payment to the physician of $1,000 a month or $2,000 a month, then that may prevent a nurse practitioner from delivering that care in a place where there are vulnerable patients. And so what I would love to see happen is that we focus less on the contract, which there's no documented evidence that that supports patient care quality or improves quality outcomes, and really allow clinicians to practice to their top of training, but also intensify our approach to peer review. You know this about me. I am a advocate truly for ongoing continuing improvement, for evaluation of clinician performance and quality metrics. And everybody, including the public, deserves to know how the clinician that's caring for them does on key performance indicators.
Yeah, I know a ton.
And you can even put on your public health hat with that one. You know.
I know a ton of nurse practitioners that's getting into that. And, I think getting out there in those rural areas, providing that high quality primary care. I think that, COVID showed us a whole new way of doing things. So introducing those virtual services, those telehealth and those telephone visits is good. Home visits. Community outreach, get out in those rural areas, do those health fairs, do those pop-ups, and educate the community.
I was on this is a totally aside, but you mentioned the contract. I was on a webinar yesterday, actually, about empowering digitally enabled care, which is a whole new world out here in these streets. And one of the physicians mentioned, because they're in this realm, in this particular practice model that they were discussing, they were really looking for opportunities or ways in order to code these services appropriately using CPT. But one of the things was, one of the challenges that they mentioned was, we're virtual, so we don't necessarily have an address. We don't necessarily have a place of service. And so with contracting with nurse practitioners or other advanced practice nurses, they're running into a challenge with that because of the regulation and what the rules are as it relates to the collaborative agreements that must happen. And so I thought that was an interesting spin on something that we've been talking about, just within states or within facilities, but now that it's exploding into this virtual care world, which is a interesting take on it. So I thought I'll share there. No question for that. Just thought I would share that additional information that as we are looking at additional care models, some of the challenges that maybe if we address them in our traditional way, that can assist in alleviating the challenge in these new and upcoming ways in which healthcare is moving. So my little 2 cents and soapbox for that. The article also suggests that there are increased costs with nurse practitioners. Are there studies that explore the potential cost benefits of nurse practitioners managing routine care or freeing up physicians for complex cases that you are aware of?
There's a lot of evidence. And I know the articles that the AMA cites, and I would say that there are just as many studies that say the opposite. I think the evidence is mixed. I would say it's skewed towards the positive. And so when you look across multiple studies, largely there's no difference. And I think we have to be careful about evidence always, evaluating the research and looking for bias and looking for whether the study was a quality study. I think that on both sides of the aisle, we are guilty of stating that evidence is fact, and that's not necessarily so.
Right. I agree. Even as research from my public health hat, you kind of have your theory in mind, and while you are really looking for the evidence, if you will, to support or refute that theory, there's always bias, and so you may be leaning on looking at evidence to support or refute, depending on which side of the coin you're standing on. And so you may have like 30 articles that support everything you are supporting, and then 10, if you will, that are against. And so it can be slanted. And so to your point, it's very critical to make sure that understanding where the evidence is coming from, understanding if indeed there are biases in the evidence, and we always make sure we look at where the money comes from, because sometimes that money will dictate the research and what the outcomes, what they want folks to take away from the information, the evidence, and the outcome. So
For sure.
following that money trail is always important as well.
It's so important. And one thing I would say about evidence, organizations like the AMA sometimes seem to pit the physicians against the nurses. But what I would say about evidence is there is a preponderance of evidence that shows that general advanced practice clinician and physician relations are quite strong. So while there may be pockets of animosity, generally APRNs and physicians work quite well together.
Yes, and you do. We see it all the time. Like I said, I think this little small war that's happening is for a certain group. Most providers that I know personally, they're very collaborative. They understand that diversity at the table among the clinicians ultimately provides the best outcome for patients. And they work in that collaborative spirit. So, it was very interesting to me when we started seeing these articles like, whoa, 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 what is all this? Where, it felt like an attack. And I'm not a clinician by any means, but I felt personally attacked just reading the information. And then it went on to include physician assistants. It went on to include pharmacists. Just, even some of the psychiatrists, I mean, other physicians that you would think, okay, this is their scope of practice. This is their specialty. Why? And so, I think it's always been my practice and always been best suited for me to provide you level up, you manage up, you show the benefit of working with and collaborating with someone else versus trying to knock them down or tear them down. And so it made me raise an eyebrow like, really? Is all of that really necessary? And unfortunately, again, as we talk about money, there is money in this machine because literally every week there's something that they're saying related to this scope creep madness. So it's like, but why? And you would think that allowing patients to have more opportunities to access however it comes or however it looks is ultimately beneficial for the patient. And it's not a slight against the provider. It's not a slight against the physician. And that was another thing I remember they talked about. They don't want to be called providers at all. They want to be called physicians. They want the actual title. And then the whole doctor thing, which, we talked about that, like, well, really, those who have the doctors were really for those who had an advanced terminal degree, not necessarily a physician. So if you go back to the history, be careful with what you ask for. But yeah, so hopefully this battle can right itself as we think about ultimately what's best for the patient.
Yeah, keeping that in the center of everything, it is certainly what we need to do as healthcare clinicians at the practice level, at the state level, at the national level.
I haven't seen much about driving the cost up, but I have seen articles that have talked about implementing nurse practitioners definitely help drive the numbers down, and it is a cost benefit.
As a cost
Yeah,
saving.
absolutely. I mean, because the first thing you got to look at is we cost way less. Even though we do some of the same work, our salaries are very much lower. And then, we push preventative care, health maintenance, health promotion, and that ultimately drives the numbers down as well. And so, with NPs providing primary care, I think absolutely it frees up. Like I said, doctors don't stay in primary care long. So if we move into primary care, they can move into, surgical procedures or, more complex cases, certain specialties. So, yeah, some of the studies, like I know the American Academy of Nurse Practitioners, they've put out a ton of different articles specifically about that. And so I haven't seen much on these other swing up. Maybe I'm mistaken.
All right.
The article criticizes online NP programs. So how do you stay up to date on the latest advancement in your field? And how can we ensure all nurse practitioners have access to high quality continuing education opportunities?
This is something that I'm passionate about. And I'll take the second part of the question first. Committing to lifelong learning is something every clinician does. And I'm grateful to work for an organization that supports that for all clinicians. I think that we do a wonderful job of exposing our clinicians, whether they're physicians, advanced practice registered nurses, physician assistants, pharmacists, whoever that's a part of the care team, our nurses. We immerse them in multimodal educational opportunities. I think that is a foundation. In terms of online training, during the pandemic, everyone transitioned to online training.
Exactly.
Now, do NP programs have opportunity to ensure that they are bringing in the highest quality candidates, that they are preparing those clinicians to practice? Sure, they do. Is there opportunity for reform in that space? There sure is. I would offer that there's opportunity in all of our clinical disciplines for our education to evolve. Adult learners can learn online. We have evidence that supports that. Obviously, clinical training happens with patients. And we deliver care in front of patients sometimes and virtually sometimes. So I think our training needs to diversify based on how we're delivering care today.
Truly agree. And I think most of the not only the clinicians, but other staff involved in healthcare, should understand and appreciate that all of this is lifelong learning. As things change regularly, you know, particularly from a revenue cycle perspective, things change, and you have to be all on the front end of those regulations. In the compliance perspective, we're always on the swivel looking to make sure that folks understand what is happening as regulations are changed. And so it's refreshing to know that we all have to understand that in this lovely profession that we decided to dive head first in, what you learned yesterday, you may need to learn more about today, and in weeks to come. So grasping that and embracing that is what makes all of us the best that we can be, again, for ultimately the end result, and that is our patients.
Absolutely.
Yeah, I think like in our organization, always get professional journals, like I talked about the American Academy of Nurse Practitioners, get their journals, tools such as Up to Date that we use that gives us a plethora of information. It's right at your fingertips, anything that you want to know. Workshops, conferences that are put on by professional organizations such as AANP or, all of the organizations. And then making sure that nurse practitioners have access to it is I'm always encouraging them join an organization like, professional organizations, the African American Ambassadors for Excellence in Advanced Practice Nursing,
Yes.
OAAP, and join those organizations, not one or the other, join both of them so
Both.
that
That's
that's
right.
exactly what we do. Like we push new laws, we push new medications, we push new policies and procedures and changes. And so I always tell people you can't be out here practicing on a little island by yourself and not knowing what else is going on in your career community. That's how you're going to know what the new up and coming is, what you need to change in your practice. And so you're doing yourself and your patients a disservice if you're not doing those things.
Yes. I love it. I love it.
So, Amanda, do you have any final thoughts as we wrap up for today?
I think I would say that I have deep respect for my physician colleagues, and I have deep respect for nurses. And I think that at the end of the day, when you ask almost every nurse and almost every physician, all we want to do is take care of patients, and the rest of this is just noise.
And turn that noise down. Turn it down. Well, thank you again so much for your time today. I really appreciate it, and it has been a pleasure catching up with you
Yes.
these last couple of weeks just to make this happen.
Well, share if you like. Are there things going on with the AAEAPN that you would like to share? Do you have any events coming up, or any specific advocacy efforts, or anything that you would like to share about your organization, feel free
Sure.
to do that at this time.
We're open to new Black and Brown nurse practitioners and students because we want to be able to provide, education, empowerment, community. And so we do a monthly meeting and educational dinner program. And then we're always doing stuff in the community. I think we got a health fair coming up with Peace Baptist Church in a couple of months. And we're always open to do conversational pieces, speaking engagements. We go talk to the schools, just to start informing people early, about options in healthcare, what nurse practitioners are, what we do. And so we're always happy to come out and do that as well.
Yay. So I know you're local here in Cincinnati, but do you take members or other nurse practitioners from across the country or regionally, or
Absolutely.
okay.
Yep. And we have a
Okay.
private Facebook group. We can be found on Instagram and Facebook, but we also have a private nurse practitioner group. And so that is where a lot of our nurse practitioners from other states come in and put input and stuff. So, yep, we take nurse practitioners from.
Well, make sure you provide me that information, and I can make sure to add that to the information that we send out regarding our discussion today, so that
Absolutely.
if folks are interested in partnering with you all, they can definitely see what's going on over there at the AAEAPN. Yes.
You got it. You got it. It's a long one, but you got it.
It's a long one, but I got it. Well, thank you so much, Sonya. This has been a joy, because we are always trying to spill the tea. We did spill some tea today. And I love that we got a different perspective. I love that we were able to kind of unpack some of the myths, if you will, all while, providing folks with options and providing folks with how they can particularly move when engaging the healthcare community with their physicians and or nurse practitioners. And I think the key is to Ms. Sonya's point, communication. Just, listening, hearing what is being said, and also sharing your voice and being an advocate for yourself. We have choices, y'all. I don't even know any other way to say it. We have choices. I know for me, I am like I don't take medicine. I try to live a lifestyle that affords me that opportunity where medication is not needed in my life. And I try to stay along the holistic medicine piece initially. So if something happens and, we may have to have some other kind of conversations, those who are involved in my healthcare understand that. And so they know how to approach me. Okay, look, I was reading this book. You might want to go to the library and get this book and read on so and so and so and so before we make any decisions and and so they know how to approach me. And really just appreciating that your healthcare provider is part of your team. They're part of your circle of people that are there to assist and help you. Particularly in the African American community, because folks are definitely scared to death of receiving healthcare. It's gotten better over the years, but oftentimes they will only seek medical attention, or they're not preventive at all. They're not proactive. It's always reactive. So, oh my God, I hurt this, or this hurts, and it's been hurting me for 6 months. So I guess now it's time for me to go. And then sometimes it's at a stage where, unfortunately there's nothing you can do. So everybody will see, oh, well, Johnny went to the doctor and then 6 months later, Johnny was gone. Well, Johnny had this lump that's been there for 20 years that they never addressed. So, of course, they don't tell the full story, which scares others from seeking medical attention, and then the cycle continues. So I do appreciate that we are now at a place where, you know, having those one-on-one conversations, understanding that one, everybody is individual and unique, and what may happen to Johnny may not necessarily happen to you, even though you may have a lump on your neck too. So go get it treated. Go to have somebody take a look at it. And not only do you have a physician who could potentially take a look at it, but you have a nurse practitioner who may also, you may want to be on your team and take a look and can assist you maybe sooner than that physician, and provide the same, or if not better, quality of care. So I do appreciate the conversation. I appreciate you taking the time out of your day to spend some time with us and just, you know, giving us your perspective. I'm excited for you, and what he has for you, and, you know, continue to do what you do. I love it. Keep shining, girl. Keep shining.
Thank you. I appreciate that. And like you said, it's all about, you know, we have to be an advocate for ourselves on the provider side as well as the patient side. And I always tell my patients, you know, if that provider does not work for you, then get you a new one. You have to have someone that is going to work for you, and you guys can work together. And that is going to bring out the best overall well-being of the individual. So I appreciate you having me. It was an amazing conversation. It was a much needed conversation.
Yay.
Oh, thank you. Thank you so much.
I love it.
And if this information was valuable for you, help us share this message with others by sharing the video and subscribing to the channel, the Professional Reimbursement Network. And be sure to follow us for more information on all things health information, compliance, revenue cycle, and medical coding. And as you leave out, don't forget, if you didn't hit it already, to hit the thumbs up or like button. Again, this has been a great session. I appreciate you joining us and taking the time to watch. Until next time, I'm Clarice Warner, the girl with the pearls, the founder and senior education director of the Professional Reimbursement Network LLC, where coding education is key. And if you want to know more about medical coding, compliance, the revenue cycle, and healthcare in general, well, watch one of these videos. Remember, be safe, be kind, and don't wish for it, work for it. Take care, and thanks so much for watching.